to be the nurse and the two pharmacists who will be visiting a patient in the home. Do we have the scenario?
These are your objectives, and this is the scenario that you're going to have for today.
So we're going to have 3 sessions here. This is the pre-session, which will be 20 minutes. Each session is 20 minutes long. Then we'll go and do the simulation for 20 minutes, and then we'll debrief for another 20 minutes. So you will have this time for the next 20 minutes or so to get to know one another, set some plans, set some expectations for what you're going to do. And we'll go from there. There's a couple points that we want to cover before you start discussing.
We're just going to go over the fiction contract for how this is going to work. So just so you know, there are medications in the room. They're Practimeds. They're not real medications. However, they're designed to look like real medications. I believe they're still in the sleeve, which normally you wouldn't have, but that's so that you can easily identify them. So what it says on that sleeve they are, that is what they are. Okay. There is an infant mannequin in the room. It's not high fidelity, so it's not going to cry, it's not going to breathe, it's not going to do things you would expect an infant to do, but it is alive. So you don't walk in and think like, oh, the baby's dead and start CPR. It's alive, it's just not high fidelity. If at any time in the simulation you need to call a physician, the pharmacy, or home health agency, anything like that, you can do so. We will answer and take on the role depending who you choose to call. So just say I'm making a phone call and go ahead and make the phone call. If there's anything you feel like you need to step out and there's anything you want to say or talk to each other about that you wouldn't want the patient to hear, you can just come out where we are so we can hear the conversation and the patient won't hear you. So you can feel free to do that as well. As Dr. Wells said, there's no pass-fail with this. The only way you could fail the simulation is if you break your contract and go and tell somebody about this. Then it's academic dishonesty. But other than that, this is meant to be formative, meaning that you're just going to be learning from this, learning to each other's roles, learning to collaborate with each other in a community setting. So the focus is really on the learning, and we're not going to be sitting there with a check sheet. There's no grade involved in this. So just participate. So for the next portion of this, what we'd like you to do is introduce yourselves to each other, your names, kind of talk about the nurse's role in the home and any experiences you have with it, the pharmacy role going into a home, if you have any experience with it, talk about your anxieties about the simulation or going into a real home as a pharmacist or nurse, and explain your roles to each other so that you kind of have an idea. And then you can review the case together and make your plan for what you're going to do when you go in the room.
Oh, I'm coming.
All right.
Hi, can I help you?
Hi, I'm Heather. I'm from the home care agency.
Oh, yes.
I'm a nurse.
They told me they were sending people over.
Yeah.
Hello, I'm Joffrey. I'm a pharmacist.
Hello, hi.
I'm a pharmacist.
Hi, come on in. Come on into my living room and sit. My back's really bothering me. I have to sit down a little bit here.
All right.
Seat.
Sure.
You want to sit in your recliner?
Sure, I just make sure my granddaughter's okay.
All right, so what's going on today?
Well, I'm having a lot of back pain. I've been having it now for several days, and I just knew I couldn't go to physical therapy, so I called and canceled. And the agency was a little concerned that I had canceled this week and then one day last week, because this pain just doesn't seem to be, can't seem to get comfortable.
Okay, all right. And why are you watching your granddaughter today?
Oh, isn't she cute? Well, I'm her babysitter.
Okay.
Yeah, my daughter, she just went back to work. She's a single mother, and we're trying to help her with the costs of things.
All right.
Because waitresses don't make that much money. You boys available or something? She's a nice girl. So she looked into daycare and babysitting, and it was just too expensive. So I told her I would babysit. I hurt my back like a year ago, and they wanted me to have the laminectomy. I mean, I went through the physical therapy and the pain management, and it just wasn't effective. And when she announced that she was having the baby, I knew it was time so I could help her out.
All right.
Afterwards, yeah, we're trying to do what we can. She looked into bottle feeding and stuff, but it's so expensive, that formula. So So she's gonna continue breastfeeding, and we even, you know, we use the cloth diapers, we do whatever we can to really, to help us. But she's a good baby, she doesn't sleep, 6 weeks old, she sleeps all the time.
All right. Have you been able to care for her this morning? Have you fed her and
Well, my
made sure
daughter
she
fed her before she brought her over here. She comes about 7 in the morning, so she fed her before she came in. Yeah, that's only 3 hours ago. And my daughter, she'll take lunch at noon. She'll come, I'll have some lunch for her here, and she'll, you know, bring over whatever breast milk she pumped, and she'll feed the baby while she's here. We have a nice little thing worked out. And thank goodness the baby sleeps and she's so well behaved, because that way, you know, I don't have to be picking her up and fussing with her and stuff, so.
All right. So what pain medications did you take this morning?
Oh, my Percocet.
Okay.
Get it for you. I kind of brought it down and left it out when I took it this morning. Yeah,
Sure.
I mean, nothing has changed with them. When I came home, they were ordering the Percocet 2 tabs every 6 hours for pain, and I was doing wonderful, but I don't know.
Do you mind if I take a look at that?
No, go right ahead.
Okay.
They just don't seem to be working. They used to send a nice little pretty blue pill, and now they had to change them out, you know, between, I don't know if it was an insurance thing between the generic and the brand or what was going on. But yeah, we had it all worked out. The pharmacy was bringing it off and dropping it off at my house. But you know, my daughter, since I started babysitting, she said she would help me out, and so she now goes and picks it up at the pharmacy. And so they explained to her that I don't know if they ran out or if it was wet. It could be weather related with the bad storms we had, or if it's insurance. So now I have a red and a blue in there, but I don't know. They just don't seem to be as effective. I don't know what's going on.
Okay.
And how did you arrive at that conclusion?
It really hit home when the pharmacy didn't know about it. She wasn't taking anything else other than the Percocet, and her daughter also had back pain. She started picking up the meds for her.
Yeah.
Yeah.
It's kind of like warning signs and put them all together.
The fact that she would leave her daughter with your mother who just had surgery all day long is another thing that shouldn't have happened.
So what do you think in terms of your interactions? What do you think went well in bringing you to the conclusions, and what do you think you could have done differently?
I think been a little more direct. I think she wanted to carry on more of a normal conversation, which I can understand, but I know just with our limited amount of time, we could have been more just focused as far as what we needed to do.
Yeah, pretty much. Just more like direct questions, because Mrs. Haas was like going, and we're just like, so it was hard to cut her off. But if we would have been more direct and like instantly told her that they weren't all parts and see what she came to. So.
Okay, so what do you think went well, though? So you told me what you thought you could have done better, but what do you think you did well? Because you did a lot right. You did a lot.
Yeah, I think
well,
they
you did
asked the right
consider-
questions. I think they definitely asked the right questions.
I think we kind of explained it to her in a way that didn't necessarily alarm her or make her worried.
Yeah. I think it was good to start asking those questions, consistent with medication you're taking, and then narrow down, you know, what could be the cause of it. Is it her just mixing up pills? Did she drop them? Did she have another bottle that accidentally got mixed up? Was it an issue with the pharmacy? But you get those out of the way, and then you can kind of narrow down what the cause might have been.
But you're suspecting diversion.
Yeah.
So what do you think, approaching a scenario like this, what do you think the role is of nursing, and then I'll say the same, what do you think the role is of pharmacy when you come into a situation like this?
To advocate for the patient. A lot of it is about advocation and like actually, like the fact that we went there and we checked her medications and we called the pharmacy and we called the home health, and instead of just being like, oh, well, you know, it makes sense for her to be on Colace, and just kind of letting it go as that was important.
Okay, so that's kind of a global patient care, I get that. You walked in and you started listening to her lungs and started looking at the scar that miraculously healed over the last week. Knowing we had some time to prep, and you went in and did it live, knowing now hindsight 2020, would you have changed your approach? Would you have said, okay, I want you to ask these questions and you ask these questions? Would you have done anything differently?
Maybe more have had more specific questions, but it's hard to do that without knowing the exact what you're walking into. I thought Heather did a great job assessing patient and doing what she needed to do. I thought we just kind of sat and observed and listened as far as like the pain assessment.
Plus, I think, you know, if you don't know what you're walking into, you have to ask those questions, and you can actually get a lot more out of the patient to kind of help you understand what could be going on.
And then what do you think pharmacies can contribute to a scenario like this? So they said you can do a lot of the assessments.
Right. I think they did a great job by like a lot of the questions that they asked about the medication was something I wouldn't have thought of, like, you know, when did you get this refilled, like stuff like that, and calling the pharmacy and advocating for her. I think that was like really important.
You mentioned in pre-briefing that, there is a 6-month-old infant in there. So that must have something to do with it. So you went in with a plan to assess the baby in that situation. What do you think now, looking back, about that baby being in the room?
I think that the baby wasn't getting the, well, I mean, she said that the baby was sleeping, and I can't really assess whether a baby doll's sleeping or not. But I think the fact that she was feeding her at 6 o'clock in the morning and then not until 12 is kind of like a long stretch for a baby that is that small. I feel like I asked her if, you know, she needed change, and she was like, oh, she was changed when she came here, but it's 10 o'clock, that's 4 hours for a kid, most likely.
How was she feeling the baby?
I honestly, she wasn't.
Pick up on it?
It was breastfeeding, but so she was
So
doing
who
it,
is breastfeeding the baby?
the mom,
And
and
who's
she's
taking the
taking
Percocet?
Percocet. Yeah,
So why do you think the baby might be sleeping?
right, exactly.
So the baby was in there for a reason. The baby was in there for a reason.
So then, okay, so I think you recognize the diversion well. I mean,
Yes.
this doesn't seem right, even though the mother said that my daughter does this and there's generics and switching manufacturers, which that happens. But then you suspected that the mother might be diverting. But then we just opened up another situation where the mother's breastfeeding and consuming Percocet. What does that mean now?
That's abuse to the baby. I mean, that's something that needs to be reported
How do you report that?
through mandatory like child abuse reporting, like Childline.
Okay. So there's a mandatory child abuse training program that all licensed healthcare providers in Pennsylvania need to do before they get licensed now, taking effect 2015. I think pharmacy may have already done that. If you haven't done it yet, you will have to do it soon. In nursing, I believe, if you haven't done it. All right, so you just did it.
So you see how this fits in?
So now
Yeah,
it's
I
time.
knew it was going to. I knew it was going to. That's
It's-
why I was.
Just did it.
It's interesting because you're the way you, I think you recognize the diversion, but it's a sensitive topic. How do you tell a mother who thinks the world of her daughter and is taking care of her daughter's child that there's a diversion situation going on, and it's difficult. So your role as a healthcare provider is not necessarily to investigate or try to solve the child abuse problems related to that diversion, but rather state the facts and report them to child abuse line. So that was the last piece we were looking for. You almost got there. You got to that diversion. We kind of ran out of time. Maybe with more time you would have gotten there, but I think we just almost got to that. Well, what about the child? And so who